California is currently facing one of the most alarming surges in COVID-19 cases in the entire country, and this wave is raising serious concerns among public health experts and residents alike. But here's where it gets controversial. Delays in the vaccine rollout, largely tied to political decisions, could significantly worsen the situation. And this is the part most people miss when they think the pandemic is over. Across California, local health officials are increasingly vocal about a rapid rise in COVID infections driven by the new subvariant called Stratus. Dr. Matt Willis, who previously served as Marin County's health officer, shared in a recent blog post that California is squarely in the midst of a COVID-19 surge, with infection rates ranking among the highest nationwide. This is not a mild uptick. It's a serious wave hitting the state hard. To put this into perspective, emergency department visits related to COVID-19 are now more than double what they were last winter. While these numbers have not yet reached the peak seen during last summer's surge, one group in particular is seeing a sharp increase. Children under 12 are now visiting ERs at more than twice the average rate for California. Even more alarming, for seniors aged 75 and above, hospital visits for COVID have nearly doubled in the past month, indicating the virus is affecting all age groups with renewed intensity. In addition to hospital data, wastewater surveillance across the state confirms a widespread surge, showing consistently high levels of viral presence in community sewage samples, an early warning sign that infections are climbing everywhere. Dr. Elizabeth E. Hudson, Kaiser Permanente's infectious diseases lead for Southern California, warned the Los Angeles Times that outpatient cases are climbing just as school resumes, which could fuel an even greater spike. She emphasized, "We should brace for a notable increase in COVID cases among children over the coming weeks, a trend already visible in other parts of the country. This timing couldn't be worse, with kids returning to classrooms and vaccines lagging behind." Now, the controversy deepens. The Trump administration has been criticized for hampering the timely availability of the updated fall vaccine. Although the updated shot was federally approved by June of last year, distribution has lagged, partly due to the current leadership of the Department of Health and Human Services by Secretary Robert F. Kennedy, Jr., a known vaccine skeptic. Kennedy has publicly questioned the safety of mRNA vaccines and even dismissed the scientific consensus of the CDC's Vaccine Advisory Committee, which includes 17 experts. In a bold and contentious move in May, Kennedy announced that the CDC would no longer advise COVID-19 vaccinations for healthy children and pregnant women, a stark reversal from previous recommendations. Kennedy tweeted, "Bottom line, it's common sense and good science. We are one step closer to fulfilling the promise to make America healthy again." This viewpoint sharply contrasts with prior CDC guidance, which recommended vaccines for all individuals aged 6 months and older. This new direction has raised alarms among infectious disease specialists. Dr. Peter Chin Hong from UC San Francisco described this policy shift as potentially creating a major barrier to vaccination efforts, which could have widespread public health ramifications. Meanwhile, leading medical organizations are pushing back. The American Academy of Pediatrics continues to strongly recommend COVID vaccinations for children ages 6 months to 2 years. Similarly, the American College of Obstetricians and Gynecologists has reaffirmed updated guidance endorsing COVID vaccines for pregnant and breastfeeding women. Dr. Willis points out, "We're caught in a difficult limbo caused by an administration hesitant to fully support vaccines. As the availability of the 2024-2025 vaccines dwindles and access to the 2025-2026 version is still not here, we see transmission rates climbing, especially in California. This in-between period is dangerous since people who need protection most face uncertainty and lack of timely options." For those wondering how to navigate this challenging situation, Willis offers practical advice. If you belong to a high-risk group, try to get vaccinated now with the current version of the vaccine if available. If I were your doctor, I'd recommend you get the vaccine right away if you haven't received a shot this year. He says, if the current vaccine is not accessible, sign up for updates and plan to get the new vaccine as soon as it becomes available. Consider wearing an N95 mask indoors, particularly in public spaces, to reduce your risk, especially if you are vulnerable. Stay informed by following public health updates on social media platforms like Instagram, where experts are answering community questions in real time. But what exactly is the Stratus variant that's fueling the rise? The XFG COVID-19 variant, nicknamed Stratus, is currently the dominant strain spreading throughout the United States. Data from the CDC shows that by late June, Stratus made up about 14% of all COVID cases nationwide. It was first identified in Southeast Asia in January, but only appeared in U.S. surveillance systems in May. World Health Organization classifies XFG as a variant under monitoring. Unlike previous variants, Stratus is a recombinant hybrid of two Omicron strains, LF7 and LP81.2, which may help explain its increased transmissibility. Dr. Albert Koh, a public health expert at Yale, told Today.com that both the Nimbus variant and Stratus seem to spread more easily than other strains. Experts also suggest Stratus may be more effective at evading immunity, whether from past infections or vaccines. This could mean it poses a new challenge to controlling the pandemic even as vaccine recommendations continue to evolve. However, the CDC still emphasizes that vaccination provides critical protection against severe illness, hospitalization, and death. Symptoms of the Stratus variant generally resemble those of earlier Omicron infections, but there's a twist. Hoarseness of voice appears to be a distinctive symptom not commonly seen before. Other reported symptoms include sore throat, hoarseness, fatigue, nasal congestion or runny nose, cough, gastrointestinal symptoms like nausea, vomiting, or diarrhea, fever or chills, muscle aches, shortness of breath, loss of taste or smell, headaches. As California continues to grapple with this surge, many questions remain open. How will vaccine skepticism at the federal level affect the state's ability to contain the virus? Is withholding vaccine recommendations for certain groups scientifically justified or politically motivated? And what can residents do to protect themselves when vaccine access is limited and new variants keep emerging? We'd love to hear your thoughts. Do you agree with the current vaccine policies, or do you believe a more aggressive vaccination campaign is needed? How are communities in your area coping with this latest wave? Join the conversation and share your perspective. Stay safe, stay informed, and remember, the pandemic isn't over yet, and understanding these complexities is key to protecting ourselves and our communities.